Welcome back to Vitality Check. I'm glad to be able to host today. Thank you for the mention, Dr. Sean Landry.
The invite.
The invite. As always, joined by my two wonderful, wonderful colleagues. Immediately to my right, Kevin Longfray.
Well, you could come to one. Or left. They'd want to. Maybe it flips. Maybe it flips on.
Maybe it flips. And Dr. Sean Landry. Welcome back, guys.
Thanks for having us, Jason. Thank you so much.
Now that Kevin has finally graced us with his appearance and his tardiness yet again on a Monday, it's nice.
Excuse me. I have been here
finally.
last few.
It's true.
I was away.
Yeah. And you're about to leave again.
Yes, insurance meeting. Life insurance.
Yeah, it's heavy.
I know.
Every month, if you look at what you pay towards various insurances, it's don't look close. It's frustrating,
demoralizing.
Yeah.
Well, the worst was, as I told you, had we been advised to lock this in for long-term, well, term insurance, but for the time we needed, it would have been very affordable. Now our term ended. I don't know why they just did a 10-year one, and now like, oh man, it went from like 817 for the same. Obviously, we're gonna look at what we need, but it went to like from 814 a year to 6,000 a year because you're older now. 10 years older. And I'm like, for the same coverage, you're like, that's insane.
Yeah. And you have to go through all the tests and stuff, and blood tests.
I don't think so. I think if we stay with the same thing, but
strip search.
Yeah, definitely.
Yeah, nice. Otherwise,
we should have done it for the time that the kids needed us.
Of course.
Anyways, it is what it is.
Lesson learned.
Lesson learned.
Yeah. Pay that one for
if you ever win insurance. No, unless you're gone, right? Then unless you're dead. Yeah, unless you're dead. Even then, I don't know.
Someone's winning, just not you.
Just not exactly. Exactly.
So I'm gonna pay for all these things just in case things happen.
Yes.
But if they never do,
I know. Yeah.
Anyway. Well, I know that normally I like to kind of chat a little longer, but I know there's pressing needs after this episode, so we'll get right to it. So first of all, for anyone who has not listened to our previous 3 podcasts, we had the opportunity to speak to 3 of our newest team members at Vitality. Great chance to speak with Obama. Not Obama. No, not yet. We had a chance to speak with Melanie Le Cavalier, who's here that does breathwork at the clinic. We spoke with Dr. Sarah Pearson-Legault, a naturopathic doctor, and Stephanie Baker, one of our 2 physios at the clinic. So we had a great time getting a chance to hang out with them, because we don't always get a chance to do that ourselves as much as we like, because we're always busy at work. But it was really fun to get a chance for them to share their stories, to see what got them interested in their own respective fields, what drives their passion and continues to do so today. And it was really great to see how their paths and listen to their journeys and really just about how much they want to play a role in our community, and how passionate they are about bringing people's state of health to help people achieve their optimal health right here in the West Island of Montreal and beyond. So a lot of fun. So we thought maybe today's episode we'd piggyback on that a little bit and explain, well, not explain, but I guess just kind of discuss how that's the whole point of having a wellness clinic, and why having these different practitioners, how they can touch on various aspects of health, not just physical,
and all interrelate.
Absolutely.
That was the one thing I noticed in the interviews we did, was the common passion that they each had for treating people. 2, the main objective is always the same, right? It's like to go down and find the root cause, right? So it was really cool to be able to, like you said, chat with them on another level, like really go into depth about what drives them and what got them into this in the first place. What are they looking at? What is a session like with them as well, right?
Exactly.
So for those of you that aren't maybe aware of what happens during a naturopathic doctor's evaluation and how they're thinking and what they get to, so we get to that in that episode with Sarah, and then with Melanie, in terms of talking about breath work and how that works, and why would you do something like that? Like, what can it help with? It was fascinating just to hear like their angles that they use to basically achieve the same thing, is help that person find better alignment with themselves, work on whatever pain they're in and resistances they have, and same with Stephanie, same thing. Like it was interesting seeing her background too, and doing a lot of sports and stuff like that too, and how that kind of motivated her to want to understand how the body worked and how to fix it. So yeah, it was very cool.
Yeah, well, I didn't sit. I'm actually excited to listen to the podcast because I didn't. I was helping raise money for the homeless of Montreal, doing my part,
Good one. Good one.
scoring goals on the ice. Yeah.
Nice.
No, but
Warm up.
yeah, just during the warm up.
Great warm up.
Good room guy.
All right.
Yeah.
Great
room
work.
guy. Great.
We said that in the podcast.
I heard.
We did say that. So you did listen.
No, I heard you guys chirping from
Afar.
afar. But yeah, no, listen, I've getting to spend time with them at the clinic, you see their passion for helping others, and the role that each of us play in a patient's journey towards health, right? So we talked about this even in our newsletter this month is, oftentimes um, people might have trouble kind of getting started with care or with therapy. They seem lost, right? Most of us are juggling a lot in life, and something might go. You might throw your back out. You might twist your ankle, whatever, right? So, but the common question we get is, who do I see? And our answer is, well, number one, ask in your community, is there someone that a friend of yours has faith in, and chances are, if you're in the West Island, someone might mention someone from our clinic, Vitality, and just start somewhere, right? That's what we kind of encourage people to start somewhere and start that journey. Just make the phone call. Actually, Jennifer will help, our secretary here will help guide you towards one of our practitioners here. But it works together. That's why we are an integrative clinic. It's complementary. The practitioner or therapist, whether it be myself, Kevin, Jason, or anyone here, after a thorough evaluation, we will say, oh yeah, this can be beneficial to you, or maybe we're going to refer you here, or I want you to see this person, based on like Kevin, Jason had alluded to, based on chronicity of the problem.
Right.
Maybe it's an acute problem, maybe it's an acute injury, maybe there's some underlying adaptations, maybe it's a stress psychosomatic response. There are various things, or a number of things. As we say, juggling life can throw a number of things at you, and usually it's more than one.
Yeah.
Different compensation patterns. So we're very fortunate here at the clinic and in our community, right? Not just beyond our clinic, right? We're very fortunate to work with a bunch of professionals in the community of the West Island, whether it be trainers or therapists that we continuously refer, and whether it's in-house or out of house. So that's just our view on health. It's looking at the whole picture and trying to help you guys be in the right place with the right therapist in the moment so that you can start your healing journey.
I find for us, like this is like the most exciting thing about what we do for a living, like it's painting that picture for the person, like you said, like it's trying to show them, like, because we take for granted that perhaps some people don't know how the body works, whether the mechanics of the body. Why does the body compensate? Oh, it actually compensates. Oh, I didn't even know that. I thought it didn't move.
Yeah.
Like a lot of people say that, right? So they don't understand, well, why this pain came out of nowhere. So like we've said in prior episodes, like there are signs and symptoms that are usually the last thing to surface, so like our job to kind of decode that and break it back down to like what's potentially happening with this person to create this scenario so that it came out. So then that's the fun and the puzzle behind kind of what we do, which is pretty awesome. So it's like there's a lot more education to what we do than there is. Well, obviously there's hands-on stuff for sure, but
There's a lot more education than probably a lot of people realize.
Yeah.
And also, even with the chronicity of things, it's like, it might have started, or what we think it started, as something purely physical. But with chronicity, it turns into there's a mental compartment to that too, where you're having pain every day. And what that does to you psychologically, when you've had, chronic pain for months, or you can go down to the, nutritional level, like there's lots of changes that can happen from that. And that's the great thing, like you'd said, like having a multidisciplinary clinic is the is so much fun because like Kev, you or Sean, you had said, you know, it doesn't really matter who you see because we're going to try to steer you in the right direction anyway. And we had a chance, and I was talking with Sarah during that episode, like, you know, probably a lot of my patients that come in to see me, I did my thesis on constipation, which is great. And I discussed this with Sarah. But, you know, as an osteopath, we treat a lot of the external environment, right? So yes, we treat the innervation to it and the blood flow, and we can treat the, you know, the movement of the organs themselves. And sometimes that works fantastic. But having a naturopathic doctor with us at the same time then allows you to look at the internal environment at a much different level. So the way that can work complementary, and that's just one example, that goes down the, you know, there's endless examples of how valuable that can be for the patient coming in to get healthy.
Look under the hood,
Mm-hmm.
right? Yeah.
So
Should I dive into my spoke analogy?
Okay.
I would
Forget
do
that one.
I would do this.
Do we have time? Okay.
The wheel of life.
Uh,
Oh, the wheel
you
of life.
keep working on it though.
Yeah.
It's actually
It's gonna be a good one.
It's brilliant and beautiful.
It's gonna be in our blooper reel, that's for
I
sure.
don't remember what episode that was in. We're gonna go back to that
I
one.
don't think it ever aired because
No.
there
I don't think we could.
went a little sideways.
Yeah, it was a bit squirrely.
It's true.
Yeah, it's
Well,
very
I can't wait to see the comments where I was like, yes, I would want to hear Dr.
true.
Schein's
Well, we
wheel
realize
of
that as
life,
folks.
wheel of life analogy.
Yeah.
Yeah. The wheel's okay.
Maybe with a diagram of it,
Yeah. Well, I mean, come on.
right?
My explanation is diagram enough for people.
Yeah.
They get the picture.
Maybe,
They see
maybe I was tired. I just didn't get it.
right before.
Like, yes, I
You
have.
know,
Your explanation of the spokes made me think one of those
You know-
wooden chariots with like endless amounts of spokes.
no, you ever ridden a bike before? You know, are there spokes on your bike?
Yeah, are there
Yeah,
spokes?
because the bike's not turning, the wheel's not turning on itself.
Right.
No.
Wow.
Oh man,
That was good. That was good. It was a good laugh, anyways.
it was a great laugh. Sometimes you
Great
get it out, better out than in.
It is better.
So they
than
said.
in. Well, on that note, when we
Oh.
do keep it in,
What happens?
disease.
Dis-ease,
Dis-ease.
dysfunction,
You gotta breathe it out.
Well, the explanation that we were talking about how
festers and brews into
yeah,
something.
like what causes that compensation? What causes it's anything that puts us out of ease creates that, right? So like it's easy. Like we'll say with patients quite often, or I do, anyways, is the what is it that you're going through? Could be something you're doing physically, could be something mentally. All these things that what is creating that uneasiness in the body. Addressing that can definitely help with how the body is actually receiving that and letting that go and whatever. So like it's
So if you're not addressing it and you're putting it on the back burner,
yeah,
It doesn't just go away.
It lingers
Yeah.
and then can wreak havoc.
like adding a spoke to the wheel.
No, might be. It
No?
might be no. No.
No,
I think it would
Taking
be
a spoke away from the wheel.
or really
Snapping a spoke.
snapping a
Then
spoke.
you're losing some
Yeah.
resilience.
So
there.
then, yeah, exactly. Maybe you're
Well,
turning.
I think we're getting
You
somewhere.
get it?
Yeah.
You understand it now?
Yeah.
No.
Yeah. You're adding,
Kinda.
tracking.
Yeah,
No. So you're actually removing a spoke from the wheel. You're putting it on the back burner, so to speak. You're not actually addressing it.
if you're
So
taking
it's the wheel is now untrue,
yeah.
right?
Yep.
And can't
Little
support
speed wobble at
symmetrically.
certain speeds.
Speed wobble, right?
Speed wobble.
Right off the highway.
It's the chain. Bang.
Boom.
Gone.
Baseline.
Baseline.
There we go.
Yeah. So
Now we
And-
could make a mini movie of this.
we should.
The
Oh,
spoke.
those books you just gonna
Oh.
turn.
And the guys,
That would be awesome.
baseballs. Disease.
Right in a pile of disease.
Yeah. No, I know. Well, that's essentially that's what it is. It's learning
Yeah.
how to address certain things, whether it be physical, mental, emotional, having the right team to help you see it, right? And it might be different for everyone, right? Someone might need more help in other areas than
For sure.
other.
Yeah.
It's really an educational process of you figuring out where you're at and then what you need to do to get to where you want to be. It's kind of as simple as that. And sometimes, a doorway, an entry point for someone might be more, they might be an athlete, they might get, oh yeah, okay, understand
Yeah.
the biomechanical, sports injury complex. This is what I have to do. This is how I need to rehab it.
Mhm.
For someone else, it might be more, understanding the psychological nuances of the parasympathetic, sympathetic response system. Someone else, it might be,
I think it's that's an amazing way to describe it. It's whatever opens the door.
opens the door, right?
Because like that's the only way that it helps you get better is when you feel as if, oh yeah, okay, I get this.
I get it.
I can walk through there.
I see it, I hear it, I feel it, right?
Yeah.
Whatever kind of learner you are,
Yeah.
I have a team to help me get there. I have a plan to get there.
Exactly. And it's a fun conversation to have with someone who hasn't really even contemplated that's even a possibility, right? What do you mean? Because I just
you don't know what you don't know.
Just right.
You do not know what you do not know,
right? Exactly. Sean's got a lot of potential shirts. Well,
I think a wealth of knowledge, man.
Yeah. I should do some coffee cups. Some
good.
You should.
Awesome. Well, listen, so thank you for everyone for tuning in. If you haven't done so already, again, please check out those previous episodes to discover some of our exciting new team members. And if you haven't had that discussion with your therapist before, never really thought, I never thought about maybe other things that are going on in my life and are they potentially playing a role, then now's the time to dive deep and explore what could potentially a bigger root than the one you're treating and get to the bottom of it.
Nice.
So until next time, cheers.
Keep riding your bike. Keep riding your bike. Keep those spokes alive.
Keep those spokes alive.